In Module 3, we discuss how violence in a student life affects their development. Violence affects all aspects of development. Violence can be physical, it can be emotional, or it can be sexual. The progression of violence is on a continuum, which if not halted, almost always becomes worse. Factors in society that have contributed to a rise in aggressive behavior and violence include unstable and stressful homes, exposure to media violence, and increased drug use in families. The family is a model for children to learn how to handle life's problems and whether to become violent or not. Every year, literally millions of children witness violence in their own home. The most powerful predictor of whether a child will become violent as an adult is first, whether they witnessed their parent being abused, and second, whether they were abused as a child. A child who lives in a home where there is domestic violence is 15 times more likely to be abused than a child who does not live in a domestically violent home. Traumatized children frequently exhibit signs similar to attention deficit disorder. This is because their brain is on hyper alert at all times, which affects their ability to concentrate, to pay attention, to stay on task, and to screen out environmental stimuli. They almost always have a low self-esteem and are frequently mistrustful of adults. Other signs of exposure to abuse or trauma in students include short attention span, feelings of hopelessness, feelings as if they have no power or control of what life is happening or the events of their life, learning deficits or developmental delays, early sexual activities in teens, and anxiety or depression. Hopefully, students learn that your classroom and school can become a safe haven for them. This can occur when teachers do not allow any bullying or put-downs in their classroom, when we build trust with every student, when all staff never act in an aggressive manner towards students, when we allow students to make mistakes without punishment, and when we support students in getting their needs met.